Hi, everyone. Good morning. I'm Andrea Tarr. I'm the program director at SCAN, and you're watching SCAN FYI.
Good morning, Andrea. Good morning, everyone. I'm Marybeth Kropnewski. I'm the program coordinator here at SCAN. And this morning we have a great discussion about Medicare 101. I'd like to introduce Angela Galetta-Winn from Horizon Blue Cross of New Jersey. So good morning, Angela.
Good morning.
Hi, good morning, ladies.
Well,
So why don't you tell us a little bit, tell us a little bit about yourself and your role with Horizon.
Yes, thank you. I have been working for Horizon Blue Cross Blue Shield for 18 years in Medicare, so you can consider me your Medicare expert. We are going to go over a little bit of Medicare 101. I do have an MBA in healthcare administration, so Medicare is something that's very dear to my heart. I love working with the Medicare population. I've been out in the field with Medicare beneficiaries and had the honor of speaking with many World War II generation folks and just getting their nuggets of wisdom have been amazing for me. And many of our members have been like family because of that connection.
That's wonderful.
Well,
So Go ahead, Andrea.
As a baby boomer who's on Medicare, so Medicare is near and dear to me as well. But, just in case someone is listening and they're not yet on Medicare and maybe they don't even understand what it is, can you first just give a general explanation of when we say Medicare, what are we talking about? First things first.
Yes, right. And that's a very good question because a lot of people are still working and they hear about Medicare, but really don't understand what it's all about. So Medicare is a federal health insurance program that provides inpatient and outpatient medical care for Medicare beneficiaries. It is different than Medicaid. Medicaid is also a federal and state program, but that's based on a person's income, where Medicare is based on age when you turn 65. And there are also people that have Medicare that are under 65, and those people are disabled.
Okay, well, thank you for that. That's important to make that distinction. Yeah. Okay.
Okay, and then in terms of some of the parts of Medicare, so I think that would be a good basic overview.
Definitely, because a lot of people have an idea. They hear of Medicare Parts A and B, but what does that really mean? And there's even a Medicare Part C and D. So Part A of Medicare is hospital coverage. That covers hospital services, inpatient care at a skilled nursing facility, inpatient rehabilitation, home health care, and hospice care. So Part A is hospital coverage. And Part B of Medicare are doctor visits, outpatient treatment, preventative care services, durable medical equipment like a wheelchair, an oxygen tank, a hospital bed, ambulance services, and mental health services. And under the outpatient treatment, that would be things like diagnostic testing, an MRI, a CAT scan, an ultrasound are examples, lab work, same-day surgeries. Those all fall under Medicare Part B. Medicare is a national plan. There is a deductible for Medicare. There's a Part A deductible for the hospitalization, and that changes every year. Medicare will put out in their publication on their website what the Part A deductible is, and there is a Part B deductible. Once your Part B deductible is met, it's $198 right now. Medicare will cover 80% and you were responsible for the 20%. Medicare is nationwide. As long as you use doctors that accept Medicare, you will be able to use those doctors. So there's not a network involved with Medicare. Medicare does not have a cap on that 20%, however. So that 20% accumulates and then it resets in January of every year. There is Medicare Part C. Those are called Medicare Advantage plans, which are Medicare plans with a government contract. Because what Medicare realized that private insurance carriers like Horizon, Blue Cross Blue Shield were very good at administering healthcare, like through the commercial plans that we're used to through our employers. So in order to keep costs down, because Medicare is a fee for service, it's very expensive, and a lot of people don't want to be subject to that 20% because it could be catastrophic if they have some kind of catastrophic illness or a chronic illness. Paying 20% of costs could be very expensive, especially because there's no stop loss. So Part C of Medicare is Medicare Part A and B services under a private insurance carrier. So they have to include all of Medicare services, but typically you're going to have additional coverage like vision, hearing, and dental, which Medicare doesn't cover. And there's usually a cap involved. Medicare sets the maximum out of pocket, which is $6,700 for 2020, that a Medicare beneficiary would not pay more than in case there was some kind of catastrophic accident or illness. So Part C of Medicare will always give a Medicare beneficiary all the coverage that Medicare does, but the difference is they have to use doctors in the network. Typically, there's going to be a copay for services instead of the 20%. And then there's Part D of Medicare, which is drug coverage. Now, can you believe when they, Lyndon B. Johnson signed Medicare into law in 1965, and that was the Medicare Part A and B, but there was no drug coverage for Medicare beneficiaries. So Medicare beneficiaries either enrolled in a state drug plan that gave them discounts, like PAAD is in New Jersey, or they got samples from their doctor, or just paid out of pocket. It wasn't until 2006 was their Part D introduced for Medicare beneficiaries. So Part D of Medicare is for drug coverage. Medicare does set the model on what the drug plan will look like, but you have to get it from a private insurance carrier like Horizon, Blue Cross Blue Shield, for instance. So there's Part A, Part B, Part C is Medicare Advantage, and Part D. And those are the four parts of Medicare. Medicare Advantage can have the Part D drug plan included, so that would be called a Medicare Advantage prescription drug plan.
Well, let me just say, you know, it's like, wow, there's so much to this. And of course, we don't expect everyone to memorize everything that Angela is telling us. But is there a website for Medicare that people can go to if they want to do a discovery on their own?
I go there quite frequently. It's Medicare.gov. Believe it or not, I love reading Medicare.gov because there's an actual finder on that web page that you can input your zip code, and you can find drug plans as well as Medicare Advantage plans by inserting your information, what drugs you take, and what pharmacies you use. And Medicare does the comparison for you and brings up those plans that are offered in your service area based on your zip code.
So that's important, so that's Medicare.gov. So thank you for that. Because I think it's important, you know, again, because I'm on it, you have to, every year it changes a little bit, and going to Medicare.gov and doing a little research, really, it's kind of an essential thing.
Yes, definitely.
I was going to say, and research leads us into, right now we're in open enrollment. So again, why don't you just explain what that is all about, Angela?
That's a critical part right now.
Yes, I will be very happy to. So typically, when you start Medicare, you get what is called your initial election period. That's your 65th birthday. It's 3 months before your 65th birthday, the month of, and 3 months after. And that's when Medicare gives you the opportunity to enroll in Medicare Parts A and B, and then also your opportunity to choose a Medicare Advantage plan or a Part D drug plan, or original Medicare and have a supplement to Medicare. Outside of that, if you are still working, you'll qualify for what are called special election periods where you'll be able to enroll in Part B of Medicare when you are no longer working and avoid a penalty. So every year, Medicare has the annual election period. It's October 15th through December 7th, and that gives Medicare beneficiaries an opportunity to make a change to what plan they currently have, or if they don't have a plan, they can choose to enroll in a Medicare Advantage plan or a Part D drug plan.
All right, so that's really important. So this is your one time of the year that you have the opportunity to make a change. But what if you have a change in your life, you're divorced, you're married, you lose your spouse? Is there any other opportunity throughout the year if you had to make a change to your plan?
Yes, those are called special election periods. So if you moved out of your service area, for example, that would give you the opportunity to make a change. Or if you were working for an employer and now you are retiring and it's outside of open enrollment, that would give you another opportunity to make a change to your plan. Also, if you are a PAAD member or if you have LIS, you will also have an opportunity to change your plan in addition to the annual election period one time during the year.
It's a lot.
It can be overwhelming, but I think, again, it's something that requires research, right? Ask questions.
You know what I noticed too is that you can never compare yourself to somebody else. Oh, my brother-in-law is on this plan or so-and-so's on that plan, because everyone has different needs. So you really have to make it specifically what's going to be good for you. And the only way you're going to know that is if you do a little research on all of this, right?
Andrea, you are 100% correct. That is the number one thing I say to people, because they always say, well, my friend has this plan and that's the best plan. They say that's the best plan. And I always say exactly what you say. It's the best plan is actually what fits your lifestyle, your health, your budget, and your needs. Not one plan is going to fit everybody. Not one size fits all. So what's the best for one Medicare beneficiary may not be best for the other. That's why it's always good, Marybeth, like you said, to do some research, get educated. Medicare sends out the Medicare and You book every year. I love reading that Medicare You book. I have it on my counter at home and I pick it up and I just read it because it's full of great information for Medicare beneficiaries.
Well, I'm guessing that a lot of people receive that book and it goes right in your file cabinet and you never see it until next year. But obviously, yeah, that book that's got all the hidden answers right there. Now, of course, if I'll just remind everyone who's listening that if you want to get in touch with Angela for any reason, I will make sure all of her email and her contact info is included in all the comments so that you'll be able to reach out to her directly, because she's the expert, not us.
Thank you, Angela.
Definitely. So I think that brings us to our last thought here, is that maybe you can tell us something about Braven Health.
Yes, I will be happy to. Braven Health is a Medicare Advantage plan. It's a brand new company. However, Horizon Blue Cross Blue Shield, which has been in New Jersey for over 90 years, and Meridian Hackensack Hospital System, which is one of the largest hospital systems in New Jersey, own Braven Health. So that is a joint venture between those two companies, Horizon Blue Cross Blue Shield in New Jersey and Hackensack Meridian, and we created Braven Health. It's a PPO, which means there's out-of-network benefits with over 613,000 providers and 4,100 hospitals. So if someone is interested, please reach out to me directly via email. And then I'll also include our direct line. We have a team of Horizon Braven Medicare sales executives that can answer your particular need, look up doctors and prescriptions for you. So that will be in our contact information for you.
Interesting question. I just thought about this. So this is a joint venture within New Jersey. If you live out of New Jersey, you would not be able to take advantage of this?
You do have to live in Braven Health service area. So we have Braven Health in 8 counties in New Jersey, and you have to be living in those counties. And then what I was mentioning about the network is that it does give the option of going out of network, which is our visitor travelers program. It's called our Medicare Advantage PPO network. So the counties that we are located in are Bergen, Essex, Hudson, Middlesex, Monmouth, Ocean, Union, and Passaic. So if someone lives in that service area, they can enroll in a Braven plan. However, they can use services in any of the 21 counties in New Jersey and outside of New Jersey as well.
So if you're traveling, you're on a trip in Arizona and something happens to you, this is your visitor plan kind of a thing would you be covered?
Yeah.
Yeah, definitely. There actually is a worldwide emergency room benefit on this with a $90 copay because Medicare doesn't cover you outside of the United States. The Visitor Travelers Program can also be if you are a snowbird. So if you use a doctor that's in the network, you'll pay the in-network copay. So it's great because the network can expand to Florida, California, Arizona. Those are some of the states that a lot of snowbirds like to live in during the winter, so they can enjoy this plan as in-network.
All right, well, that's important to know because if you travel, you want to know that you're going to be covered. You don't want to have a surprise expense. So that's excellent. Very good. Thank you for that. Okay, any last things you want to share with us about Medicare 101?
I would say that open enrollment is right now, October 15th through December 7th. Time passes by very quickly. So now would be the time to review your plan. You can contact us directly. The number will be included, 1-800-224-1234, or research on your own at Medicare.gov. It's an excellent resource for Medicare beneficiaries, very easy to navigate.
Okay, very good. Well, thank you for so much excellent info. Yes.
Thank you. One more thing I'd like to mention. Medicare did not publish the Part B premium yet. Currently, it's $144.60 for most Medicare beneficiaries. So keep on the lookout at Medicare.gov for that publication if you will have a rate change in your Medicare Part B. It is subject to change every year.
Any chance it's going to go down? Probably not. But we have no control over that. Well, Angela, thank you so much for so much excellent info. All of Angela's contact info we'll make it available to you. I appreciate you being with us today.
Thanks, Angela.
Thank you, Andrea. Thank you, Marybeth.
You're welcome. All right, remember, if it's important to you, it's important to us. I'm Andrea Tarr. We'll see you next time on Scan FYI.
Have a good day, everyone.
Bye-bye. Thank you.